The Gender-Sensitive Risks and Options Assessment for Decision-Making, or ROAD, to support the Work and Freedom Project Phase 2 aims to reduce vulnerabilities of short-term, low-skilled women migrants who travel from South to West Asia for work in the domestic care and garment sectors. It does so by reviewing practices and institutions that have made a positive and those that have made a negative difference for women's migration. It also directly analyzes the activities of the Work and Freedom Program, which is supported by FCDO as part of the SETL Complex Evaluation Program.
People migrate as a matter of individual choices, but such decisions occur in a complex context, often beyond the control of specific actors. Migration as a process occurs in a multiplex environment marked by international norms, state capacities, migrants' personal and social networks. Studying one component at a time in a black box fashion ignores these multiplex interactions. Therefore, our evaluation study of ILO's Work in Freedom 2 interventions considered these multiplexities by incorporating various levels of analysis, including surveys of the migrants, key informant interviews at the local level, stakeholders consultation and workshops, and structural analysis of the interactive relationships among various international, governmental, private, and NGO actors.
Methods matter. So what we found out from our work with migrant domestic workers in Lebanon is that traditional methods don't work very well because of lack of trust and because there's a barrier between the researchers and the migrant domestic workers. So what we've tried to do is we've tried to use participatory action research methods, whereby we spend time to build rapport and trust between us and the migrant workers. And we've trained the migrant workers to actually develop the questions themselves and to run the interviews and to even participate in the analysis of the data with us.
This is a complex evaluation because the approaches we take enable us to challenge the understanding and how we can address women's vulnerabilities, and it enables us to do that in multiple ways. We use mixed methods to do that. We have key informant interviews with the experts in the field and also local leaders at local district level, and it gives us a rich understanding of the context. And then we use focus groups of maybe 10 or 15 women, which tells us about their own views, and the focus group's important because it enables women to sort of sound off each other at the same time. And finally, we do household surveys. And when we look at those three sets of data, it enables us to triangulate, and by triangulating, we're looking at the same issue from three different views, from three different sources, and that enables us to verify and validate that data.
In the domestic and care sector, we found out that women experience precarious and exploitative work conditions. Oftentimes, they are not allowed to keep possession of their identity documents, like their passport, for example. In many cases, the women are not paid their salaries in full at the end of the month, and their freedom of movement is restricted by the employers. So even employers who grant the domestic worker a full day off from work, they actually prevent her from leaving the premises of their household on her own. So she can go out with them, but she would not be allowed to leave or meet friends or other women from her country of origin on her own.
The challenge women face is that they have to pay intermediaries to undertake many of the tasks that they could possibly do themselves. This may be to access the passport, to do the necessary health checks, to get the documentation, the visas, and those sorts of things. And that can be ameliorated if they had the training. They are exploited along the chain from South Asia to the Middle East. For example, First-time women migrating from Nepal generally have to migrate through India as what is called irregular migrants. So one of the ways to overcome that challenge is to have better training of women migrants so they know how to avoid those issues and to cover their own costs. And likewise, if we lifted the ban on migration of young women migration from many countries, it would be safer for them to migrate.
COVID-19 added decisively to the challenges women migrants face. We collected data from 655 returnee migrants in Bangladesh. COVID-19 has led to some reverse migrations, but more importantly has brought to the open a lot of the challenges that migrants, including women migrants, face. More than 50% of returnee migrants worked as live-in caretaker across different Gulf countries, and 72% of returnee migrants did not have access to health care. Only 15% of these migrants could access the repatriation flights. 37% of post-COVID returnees did not receive all due wages before they left. More alarming, perhaps, is the challenges of the reintegration faced by returnee migrants. They reported to face discrimination for being abroad and lack of help from family, government, or NGOs for reintegration.
The project is developing a new tool called the Women's Empowerment and Migration Index, or WEMI, to support measurement of women's agency, resources, and achievements. The tool supports measurement for Sustainable Development Goal 8 on decent work and economic growth, specifically Target 7, which aims to eradicate forced labor, modern slavery, and human trafficking by 2030. We build on IFPRI's very large body of work in developing women's empowerment metrics, starting with the Women's Empowerment and Agriculture Index, or WEA. The WEMI tries to unpack empowerment along the entire migration pathway, looking at women's decision-making about migration and work, control over assets and income, attitude towards employer violence, access to social networks, and various aspects of self-efficacy and mental health as a migrant. We are currently piloting the tool in several districts in Bangladesh with over 1,200 returnee migrants. And in the future, we hope to be able to build on this tool and test and validate the WEMI in other migration and country contexts.
The project is working directly with migrants in Lebanon in collaboration with the migrant community centers in Beirut. We specifically trained migrants to work as researchers. We provided them with month-long training. They are co-researchers and they are interviewing other migrant workers from their country of origin. This participatory action research approach has helped us build capacity of the migrant workers. It has helped us also build trust and rapport with them, and it has in fact improved the quality of the data that we have obtained.
The project that I'm working on is working with collaborators who are usually NGOs in Bangladesh and Nepal to understand and support and advise migrants on their rights and how that affects their agency or their choices in how they migrate. Now, this training is often done at the local level, and it includes a lot of mentoring as well. The women then can organise their own passports, can organise their own health checks, and they can understand their rights so they can bargain much better with intermediaries along the way, and thus make the migration that they're involved in much safer, and it saves them money as well.
In our study, we found that the network of migrants plays an essential role in her decision-making process. Networks are important sites of policy or project intervention because such networks involve diverse actors from various levels and allow diverse voices. Incorporating these actors and voices in the reform initiative process is very critical to reducing the vulnerabilities of women migrants, mainly from Bangladesh and Nepal to the West Asian countries like Jordan and Lebanon. Social legitimacy of both the sending and receiving countries is as critical as their administrative and political control over the migration sector.
Our qualitative fieldwork found that the training implemented by local NGOs for the potential and actual women migrants is effective. For example, as a result of the training, many women in Bangladesh have 2 bank accounts, and that means they can remit some to their family and they can remit some to themselves, and that enables them to keep some of their income for their own priorities. Also, the women who participated in the training managed more of the migration processes themselves and were able to negotiate to reduce the migration costs they have to pay.
Our research identified a series of findings from analyzing data on employers of domestic workers in Lebanon. We found out that many employers never read the contract that they signed when they first hired a domestic worker. Lack of knowledge of the contract, in fact, we found that it was linked to poor employer practices, such as not giving the migrant worker a day off. Other poor employer practices are linked to discriminatory attitudes, for example, not allowing the worker to go out on her day of rest, related to a sense of infantilizing the worker as someone who could not take care of herself if she goes off on her own during her day of rest.